Anyway, the next person I want to bring up is Dr. Small. He just started using the program, what's it been, 3 or 4 months?
The computerized system since October.
Since October, and he's a doctor of dental surgery, medicine, doctor of dental medicine. And he's a big television personality down here. He enjoys on the tube. Did that article get in the Prevention? February issue of Prevention magazine. So, Dr. Small.
I come from a rather traditional background, as I'm sure most of you out here in the audience do. I was trained in dental medicine at the University of Pennsylvania, and about 6 years ago went into the practice of preventive medicine and nutrition. And when I began the study of nutrition and preventive medicine, I approached it as most practitioners are approaching it today, with the concept of utilizing vitamin and mineral therapy as an alternative to pharmaceutical medicine. And in my practice, we were using hair analysis, trace mineral analysis, and blood chemistry work and urinalysis. But the technique we were using was very much a technique similar to allopathic medicine, I realize now, in that what we were doing was treating patients with vitamin and mineral therapy, and basically, as Joe would put it, adding more mass into the case. By giving them more vitamins, more minerals, we were just basically burdening them up with more mass. When I found out about this work, I approached it with very much a concept of healthy skepticism, because I had heard what Joe had to say and was, it sort of went outside the realm of my background, and was interested and yet wasn't quite sure on how it could fit into my practice. So we first started out by utilizing the urinalysis machine and began very conservatively. And as I started using the urinalysis approach, the colorimetric system that Joe offers, I found that it was definitely correlating with a lot of the other information I was receiving from my own way of doing the technique from the past. And when I got involved in the colorimetric system, I started becoming more involved with a lot of the homeopathic remedies and homeopathic techniques. And what I found, what was happening, is that we were getting much greater periods and releases and detoxifications from our patients than we had been prior to. And I realize now that what that meant was that with the homeopathic remedies, what we were finding is that we were getting a lot more release. Tactics to get more release. What we found was that we weren't only getting release on the physical level. Not only were patients getting better on the physical level, but we found also that it was definitely affecting the other systems in the body, the mental, the emotional, the psychological, the spiritual. And coming from a very holistic attitude, I personally believe that in order to really heal the patient, you need to work with them on all levels, not only the physical, but the mental, emotional, and spiritual. So we were finding that these homeopathic remedies were really affecting people on the levels of really changing consciousness. And I think, as Joe pointed out today, when you really want to get involved in what the real cure is, a total cure, a long-term cure, you really have to get into the consciousness level. And in October, we purchased a full computerized system. And the way it's working now in our practice is that we've set up basically a program that we run on our patients. And I'm sure everyone that purchases a system like this can integrate it in their practice as they see fit. We work a program whereby a patient comes into our office for 4 visits. The first 3 visits are every other week. The first visit a patient comes in, we'll begin by doing a complete medical history. We'll have them fill out the SAF questionnaire in the waiting room, and we run the SAF immediately before they even come back to see one of the practitioners in the office. So that when a patient comes in front of us, we immediately have the change. We know what the cores are, what the past situations are, the present, and we begin immediately by finding out and getting an agreement with the patient on what their major complaint is. And I think that's real important to do, is to really become in alignment with the patient in terms of what is their major complaint. Because if they think their major complaint is something and you're treating a different major complaint, you may find that you'll have difficulties with dealing with the case, because you need to really be in alignment with the patient in terms of what they feel their major complaint is and what you think their major complaint is. As soon as we get a resolution of what that is, we begin initially on that first visit by changing their diet. And we do that by utilizing the diet program. Again, the patient will fill out the diet survey in the waiting room prior to their first visit. We run it through the computer, and we immediately place them on a diet program on that first visit. We have them return 2 weeks later, and at that period of time, we've already on the first visit taken blood chemistry from them, urinalysis, and so we have that data that we feed into the computer and work up an allergy program for them. And so when they come in on the second visit, we're able to let them know specifically what type of allergies they have. And we also at that time give them some homeopathic remedies. And we find that by that second visit already they've made some significant changes in terms of what their symptoms have been, in terms of some resolution. When they come back on the third visit, we work a little more in depth with changing their diet and specifically give them some more homeopathic remedies, the ones that are apropos to the case. And then we have them return a month later. And at that point, we again run another SAF to see what kind of changes we have. And in practically every case, we find that there's been definite distinct changes. And when you work with the SAF, as I'm sure Joe will get into later, you can, as the numbers begin to move through the chain, you can actually see resolution of the case through the computer with the numbers moving through the chain. Things that have been in the past that start moving forward, and things start to clear in the case. And then at that point, we work individually with deciding how much further we want to go with the patient, and that is up to both an agreement between ourselves and the patient on how deeper they want to go. And of course, there are much deeper levels of programs that Joe has that you can get involved in. And that's up to, again, the individual patient. But we have found that the system has worked incredibly for us in that what it's allowed us to do is get that much deeper and further into the case a lot quicker, so that we no longer have to wait many weeks before we actually find out specifically what problems are. We can really go in there and on the first visit immediately work with the core of the case. And we find that what that has done for us is that it's really allowed us to work with people and clear a lot of their problems a lot quicker. And we're very satisfied with the approach in the program.
What about insurance payment?
Good question. We have been able to be reimbursed by insurance. As Joe was saying, a lot of the infrared is covered by Blue Cross Blue Shield as temperature gradient studies and infrared work. The urine studies that you do have codes that are reimbursable. Joe has all that information. The blood chemistry analysis that we use for the blood chemistry programs, again, are reimbursable. So we've been able to find the codes that are necessary to be reimbursed.
Full reimbursement?
Well, 80%, whatever the patient's insurance code is for. And basically, the way it works is that we spend approximately, I and an associate spend a half hour with each patient on the first 3 visits. With somebody else in the office doing some of the computer work, we're able to really have all that information so it doesn't take up our individual time. I think it's real important that as you get involved with this, if you have a person in your office, an assistant in your office, get involved with actually doing the punching in of all the data so that it doesn't take time away from your actual time with the patient.
You're a dentist.
Mm-hmm.
And what is this patient that we're seeing? Is it bleeding gums?
No, I was trained as a dentist, but I'm not practicing dentistry. I've been practicing clinical nutrition, so the patients that I see in my practice run the gamut from athletes to housewives, executives, people with all various types of imbalances and problems. So we're seeing the whole gamut from people that have advanced degenerative conditions to people that are just coming in to increase their health. And we found that it works for everyone. It really does. And I'm not going to go into individual case history like she did, but I have similar stories that I can say. The man came in extremely high blood pressure, was shaking, and within 2 weeks we brought the pressure down significantly and made major changes so that people in his office were just really shocked at the changes that he made. And again, we have many of those types of changes.
It's really funny. When I think of these people that we have, I get the funniest pictures in my mind. Like Rosemary and Tim and Dr. Small, Dr. Stern. I don't get to, you think of a person, you think of, oh, that's George. I see these guys dressed up in armor. It's like it was like a war. And these people really, we've had some of the stories. That we've shared, plus all the events. Going through this. Me and Dr. Stern go back a long way, and he's like the other people. I don't know Dr. Small well because he's been in it only a few months, but I know these guys are here the same way. They took the programs, and it was just the charge of the light brigade. Let's get them. And like Tim was saying about how he's doing better now, just like sort of backing off a little bit. But in the beginning, we were all going through a lot of changes.